Beta blockers are also known as beta-adrenergic blocking agents or beta-adrenergic antagonists. Beta blockers end in lol, so they are easy to memorize. For example, Timolol, Metoprolol, Bisoprolol, Labetolol, and Carvedilol. Beta blockers are predominantly used for cardiovascular diseases, such as hypertension, angina, myocardial infarcts, atrial arrhythmias, and heart failure. It's important to note that beta blockers are not appropriate for all types of heart failure, and in some cases can actually worsen symptoms. There are some less common uses for beta blockers that you may see as well, such as migraines, hypothyroidism, and glaucoma. Of these, glaucoma is most common. But to easily remember what beta blockers are used for, just remember cardiovascular diseases and glaucoma. Beta blockers work by competing with catecholamines for beta receptor sites. Catecholamines are normally released by sympathetic nerve endings and bind to beta receptors found on some tissues. When beta blockers block catecholamines from binding to beta receptors, they block the sympathetic nervous response. In other words, beta blockers block the fight-or-flight response, resulting in the parasympathetic rest and digest response to be dominant. There are two types of beta receptors, beta 1 and beta 2. Beta 1 receptors are predominantly found in the heart. Beta 2 receptors are predominantly found in the lungs. This is easy to remember with the mnemonic beta 1 equals 1 heart since we have 1 heart. Beta 2 equals 2 lungs since we have 2 lungs. Beta blockers have a negative chronotropic and inotropic effect on the heart, meaning they decrease heart rate and contractility. These are the desired and therapeutic effects of beta blockers. Whereas, beta blockers have a bronchoconstrictive effect on the lungs. This is not a desired effect. Some beta blockers block beta 1 receptors predominantly, like metoprolol and bisoprolol. These are called selective beta blockers and are the first line of choice. Other beta blockers block both beta 1 and beta 2 receptors equally, like propranolol. These are called non-selective beta blockers. These pose a risk of bronchoconstriction and should not be used in individuals with respiratory conditions. Labetolol and Carvedilol are special because they are a non-selective beta blocker and an alpha blocker. When alpha-1 receptor sites are blocked, it results in vasodilation of both arteries and veins. Labetolol and Carvedilol are especially effective at lowering blood pressure. Nadolol and Timolol come in the form of eye drops and are used for the chronic management of glaucoma. They are not, however, effective in an acute glaucoma emergency. Glaucoma is a disease in which a buildup of fluid occurs in the eye. This causes an increase in pressure within the eye that damages the optic nerve, leading to vision loss. Nadolol and Timolol decrease the secretion of this fluid called aqueous humor. Last but not least, some special nursing considerations. We do not use non-selective beta blockers with people who have respiratory conditions due to the risk of bronchoconstriction. We do not want to stop beta blockers abruptly due to the risk of rebound arrhythmia. When beta blockers are stopped abruptly, there is a risk of cardiac excitability. However, we do want to hold beta blockers if heart rate is less than 60 or if systolic blood pressure is less than 100, and notify the MRP for further instruction. We also want to monitor for hypoglycemia, especially with our insulin-dependent diabetics. Beta blockers increase the risk of hypoglycemia because they decrease the release of glucose. Beta blockers also mask some of the symptoms of hypoglycemia, like tremors, nervousness, and tachycardia. Finally, we want to monitor heart rate and blood pressure. This wraps up everything you need to know as a nurse about beta blockers. I hope you found this video useful, and if you did, please give it a thumbs up, subscribe, and hit that notification bell so you never miss a video. And please leave a comment down below if you have any video requests. Thank you, and bye!